Hi, if you're watching this video, then I guess you are thinking about buying health insurance. But sometimes it's quite difficult to understand what it's actually going to be covered and what's not, and how these policies work. In this video, I will explain the main aspects you need to know about health insurance. Let's start from the fact that the insurance companies do not list all possible medical conditions and whether they are covered or not in their policy wordings. Instead, they just simply divide the policy into groups of benefits, or in other words, the groups of expenses related to certain procedures. The first group, called Inpatient Benefits. This category includes all costs related to an overnight stay in a private hospital for at least one night or more. So, in other words, it does not technically matter which condition has led you to do the surgery. However, all expenses related to these admissions will fall under this group. Under inpatient benefits, you will typically find things like theatre cost, intensive care cost, anaesthetic fees, drugs, dressings, and so on. The second category is outpatient benefits. This category includes the costs associated with your treatments when the overnight stay in a private hospital is not required. In this group, you will find things like consultations with the private doctors, scans such as MRI, CT, PET scans, all sorts of diagnostics, and on and on and on and on. And the third big category is cancer benefits. I guess it's obvious that the costs related to the cancer treatments will fall under this category. It is also worth mentioning that this policy will not only just cover the standard radio and chemotherapy, but it will also cover very expensive drugs and surgeries, which are almost impossible to get via the NHS due to their cost. I guess many of you have seen these posts on social media where people are asking to help them fund a surgery that costs £80,000 or even £100,000. And in most scenarios, they are talking about cancer surgeries, such as stem cell transplants, biological therapies, or even experimental cancer treatments. And most importantly, all of these things will be covered by this policy. Now let's talk about what this policy is not covering. The main exclusions are almost the same with all providers. They will not cover monitoring and routine treatments for the chronic conditions, cosmetic surgeries, dental and optical, unless you have taken an upgrade, childbirth, aging factors, self-harm, and emergencies. What you need to understand is that the health insurance works in conjunction with the NHS, so that you, the patient or a client, will receive a treatment in the quickest possible way. NHS divides treatments into the two big categories: life-threatening and elective treatments. Life-threatening or emergency is literally any condition or injury which threatens your life and requires an immediate treatment. NHS was always dealing with these, and whether you have policy or not, they will continue dealing with all of these emergencies. Elective treatment, or other words, planned treatment, is what this policy is for. So when the condition is not threatening your life and you can go and see your GP first, then this condition will most likely fall under being elective. I also highlight a third category, which I call your own will. As you can see, I'm wearing glasses, so technically I can go and do one of these laser eye surgeries. However, this is my own will, and this policy will not cover this surgery. If, however, my GP or a specialist will tell me that I have some form of an eye condition which requires a surgery, then this is a different story, and this will fall under this policy. But if I want to receive medical treatment out of my own will, without doctor's recommendation, then it will not be covered by this policy. Another big factor which you need to consider when taking health insurance is the type of underwriting, or other words, how the insurance company will view your previous medical history. Strictly speaking, there are two main options: full medical underwriting and moratorium. With both of these options, all new conditions which will occur after you have taken the policy out are covered from the day one. But the difference will be with the pre-existing conditions. With full medical underwriting, you will need to complete a medical questionnaire, and whatever you will disclose on this form will most likely be excluded forever. With moratorium underwriting, any pre-existing conditions which you had in the last 5 years prior to taking the cover will not be insured for the minimum period of 2 years. However, after 2 consecutive years of being symptoms-free, your pre-existing condition will become eligible again. I hope you now understand what are these policies consist of and which conditions are covered and which not. The only word of advice is that if you have decided to buy a policy for yourself and your loved ones, then get in touch with a good broker like Albatross Healthcare, who will not only find you a suitable cover at the right price, but will also help you in the event of a claim. Not many brokers and certainly faceless comparison websites offer this. Thanks for watching and see you again.